COVID-19 killed 15,000 Minnesotans and 1.1 million Americans. We thought for a while it was over, but now we are learning that long COVID never really left us.
Now, this is Talking Points on CBS News Minnesota.
Good evening and welcome to Talking Points. Tonight you'll hear the estimate that long COVID hits between 5% and 30% of people who had COVID. Just in Minnesota, that would mean more than 400,000 people could have or still have long COVID. There is no cure, but doctors say treatments are improving. Tonight we will tell you why so many cases go undiagnosed. We will let you know about the crippling and potentially deadly symptoms. We'll talk with doctors and a public health expert. But first, let's hear from one of my colleagues, meteorologist Adam Del Rosso, about his own very unexpected battle with long COVID. And Adam Del Rosso is kind enough to join us now and to share your own story about long COVID. And first of all, folks, he's 33 right now. He might be 34 by the time this airs. He's a young guy. What happened to you, Adam?
So I ended up getting COVID for the first time. It was mid-September of 2021. Had both vaccines, so I'm hoping that made it calmer than what would have otherwise could have been a serious case. But even then, my first symptoms, thought it was just allergies, runny nose. I had cut the grass that week and didn't think anything of it until I lost taste and smell a little later in the week. Went through my isolation, no
Just
major
like,
hiccups.
All the rest of us, basically.
Right. I felt winded and was exhausted and had a couple of other symptoms, but nothing serious. It wasn't until a couple of weeks after the fact when I woke up in the middle of the night with severe chest pain that something felt wrong.
Chest pains, like
right. And so I was nervous because one, it was so bad that it woke me up in the middle of the night. This was 2 or 3 o'clock in the morning.
Right.
And I'm a pretty heavy sleeper. So I'm like, I don't feel comfortable going back to bed. I'm going to drive myself to the ER, which maybe I should have called 911 and had an ambulance take me, because if something would have happened while I was driving, that could have been even worse. But no, so I drove myself to the ER. Eventually get it into the room. They do a bunch of tests, and the doctors say everything looks okay except my troponin levels were elevated. Okay. I think that's how you pronounce that. I'm not a doctor. It's the enzyme that your heart creates whenever it's working under stress.
So there was one thing that was not normal.
Right. It was above the threshold. They said, you know what, we don't feel comfortable releasing you. We want to observe you longer to make sure that number doesn't spike anymore. And so I ended up being in the hospital for about 12 hours because I was still testing positive because I was so close to my infection. Even though I had done my isolation and everything, they made me go to the COVID ward, which as a 32-year-old at the time, I saw some very sick people, and it was concerning.
Right, and what were you eventually diagnosed with? Because you were eventually diagnosed with a serious form of heart disease.
Well, myocarditis is what they suspected it was. Now, I was in central Pennsylvania at the time, and where I was, they didn't have the cardiac MRI available readily. I had to wait about a month before I could get that. I had to drive 2 hours to go get it, and so by the time I had the MRI done and the doctor read the results, everything looked like it was back to normal, thankfully. But it was very scary. When I was in the ER, like 5 o'clock in the morning after the doctors had were doing their thing and I was just in the room, I cried. I was like, I'm too young to have heart-related issues. It was scary. Right.
Well, and I think your story of having to wait a month to get the proper testing is something that we're seeing here in Minnesota and also all over the country. People who are in areas that don't have major hospitals are doing it. And that's actually later in the show, you're going to hear from the Minnesota Department of Health that's going around and talking to rural hospitals and clinics about this. And you are a healthy guy, no underlying conditions.
No.
And you're a tennis player. What have the doctors told you? Do you have to be careful? Do you have to watch it? Are you monitoring yourself?
Right. Well, after the cardiac MRI results came back, they said everything looks normal. He didn't say that I need to be careful with any kind of physical activity. And so I've been back at it like I was beforehand. I had my second round of COVID maybe about a year after that, and at that time I was like, is this going to happen again? I was kind of nervous about it, but thankfully it didn't. But I'm certainly a lot more aware of what my heart's doing. If I feel something that is unusual, I'm on it a lot more.
And can you describe the pain that you felt?
I was a tightness in the chest. I also had a spontaneous pneumothorax. My lung just randomly collapsed when I was in undergrad, and it felt like that. That one was my right lung that collapsed, but this pain was more toward the center or to the left.
Your heart.
So, right. And so I was like, I don't think it's lung related, but that was the first thing that came to mind. And that's the big thing. It was the tightness. It was the pressure. And I just didn't feel right trying to fall back asleep thinking it's going to go away, and it didn't for a while.
Right. Did they tell you that potentially, were they worried that you might be at risk for a full-on heart attack?
They didn't mention anything like that, because whenever he explained what that enzyme is, what the troponin is, he said that anytime the heart is under stress, it will release that. So doesn't have to be a heart attack. And so whenever he said that, it kind of eased my nerves a little bit, but anything heart related is serious and scary.
Of course. And do you have to watch out now or be careful, or you said you're just...
No, I've been able to play tennis, volleyball, all the physical activity without issue, but anytime something could feel out of place, I'm going to treat it seriously.
And also, you were 32 when this happened. Well, Adam, really appreciate it. And you were told that it was a sign of long COVID, which actually they're finding the heart disease and heart ailments are being linked more and more. And we'll talk about that later in the show. Adam, thank you so much. We really appreciate it. Up next, the project manager of long COVID for the Minnesota Department of Health and an expert from the Mayo Clinic. Joining us right now is Kate Murray. She is the program manager of long COVID and post-COVID conditions for the Minnesota Department of Health. Thank you so much for your time.
Thanks for having me, Esme.
All right. I was unaware that MDH was devoting so many resources to the issue of long COVID. What have you been finding in your studies and your evaluations of what's going on in our state?
Yeah, so we are still learning more all the time, and there's a lot of other studies and data coming out about long COVID. So we follow the emerging evidence on a weekly or sometimes daily basis. What we do know is that an estimated 5 to 30% of people with COVID-19 will go on to have symptoms of long COVID. So some of those folks may eventually recover after several months or potentially a year or two. For others, those symptoms can be really severe and actually progress to disability. So there's a pretty wide range of experience. That's part of why there's a wide range of estimates there. But we do know that there are people being impacted by long COVID, even with some of the more recent milder variants of COVID-19.
And what are some of the symptoms of long COVID?
Well, there are many that have been reported, and part of that is because long COVID probably isn't one condition. It's really an umbrella term that describes a number of different subtypes and conditions. And that's because the virus can have some different impacts on the cells or the organ systems of the body. So we do see some kind of symptom clusters emerging. Some of the more common symptoms would be shortness of breath and tightness in the chest, pain like headaches or pain and numbness in the extremities. People have really extreme fatigue, especially after any physical or even mental and emotional exertion, and that's called post-exertional malaise. Other people have issues regulating their heartbeat, and they may have dizziness or even fainting when they change positions and stand up. So there's a lot of different symptoms. Some still have that loss of taste or smell. And the symptoms can be just sort of mild and annoying and then get better. But for some people, they are really severe, and especially those who are having the neurologic symptoms or the brain fog. That can be trouble with concentration and word recall, making memories. Those can be really debilitating and clearly impact quality of life and even employment.
And certainly the heart conditions could be as well.
Absolutely. And one other thing we're seeing, and this can also get lumped under that umbrella of long COVID, is that for some people, a COVID infection seems to be sort of a tipping point for other underlying conditions. Someone might have prediabetes and then it pushes them into diabetes. Same happens with chronic kidney disease or clotting events. And we are seeing some cardiovascular impacts long-term too. All of those are more likely if somebody has pre-existing underlying conditions. But we do see long COVID and some of these long-term complications, even in healthy people.
Wow. In terms of what you are doing, you are actively going around the state and talking to clinics about long COVID. Is that because it's getting misdiagnosed? Obviously, the symptoms you mentioned could be a lot of different things.
That's right. And it's hard because they overlap with or look like a lot of other chronic conditions. And so it is important for people to see a healthcare provider if they're experiencing these symptoms, just to rule out other possible causes. But you're right that because the evidence is emerging and evolving so fast, even providers can struggle to keep up with the latest about long COVID. So we have been convening a guiding council of clinicians from around the state, folks who work at the specialty centers, but also people who are at community health clinics and smaller clinics, and primary care providers. So they have kind of a learning community to talk peer to peer about the emerging evidence, how their practice might be evolving, and how different health systems are helping people with long COVID.
Okay. And does the long COVID, I suppose, does it take a while to emerge or manifest itself after you've had COVID?
That's a good question. For some people, presents as just sort of ongoing symptoms. So maybe their cough and their kind of tightness in their chest just never gets better from that initial acute infection. For others, they may even seem to recover, and then several weeks later, they start to experience this extreme fatigue. They just notice they can't exercise like they used to, and they're just not quite getting back to that baseline. And maybe the more they push, the worse it gets. So there are a lot of different paths it can take, and including that tipping point for other conditions as well.
Wow. Kate Murray, Program Manager of Long COVID and Post-COVID for MDH, thank you so much for your time. And we'll put your website, your pages from your website that address long COVID on our website as a link so people can access them. We really appreciate your time.
Thank you so much, Esme.
Well, joining us right now is Dr. Greg Vanichkachorn. He is with the Mayo Clinic in Rochester. Thank you so much for joining us.
Yeah, thank you so much for having me.
You are a specialist in long COVID. How would you define long COVID?
I would say that long COVID is a state of prolonged symptoms following an acute COVID infection. And when I say prolonged, it could be as short as maybe 3 or 4 weeks after the start of an acute infection. The symptoms that we most commonly see with long COVID are shortness of breath and fatigue. It's important to remember that this fatigue, though, it can be quite profound. So, for example, some patients will say that they will do something as simple as take the garbage out, and they will have flu-like symptoms that can last for hours or even days after that event. Now, while those are the most common symptoms that we see, we also see quite a few other symptoms like headaches, troubles thinking, and disturbed sleep.
I've seen some papers being written about possible connections to heart disease and heart irregularities. Is that something that we should be concerned about as well?
Yes, we've had a few patients actually develop some form of heart inflammation, either of the heart muscles itself or the linings around the heart, called pericarditis or myocarditis. It's rare, but it is something that we commonly look for in patients who are having prolonged symptoms like the excess fatigue.
What are you learning about long COVID? Because it sounds like the information is still coming in and you're learning it as everybody is going. What are some of the things that you've learned that people should know about long COVID?
Well, we're still learning about what kind of symptoms can be associated with this condition. It seems like every day we're turning over a new symptom, a new finding that could be related to this prolonged state. So, for example, we've most recently touched on GI symptoms as being part of long COVID. There's been an increase in the number of individuals who have reported things like new food allergies or troubles with constipation or abdominal pain, nausea, and vomiting. We also now have some information that shows that long COVID truly is due to an underlying immune system or inflammatory condition problem. This is not just a condition that is due to something like anxiety or another mental health situation. There really are some immune system changes that we think have come from the COVID virus infection.
So you're saying if somebody has an underlying condition, the COVID comes and sort of seizes it and makes it worse, or it evolves even into something else?
Well, it doesn't have to be an underlying condition that's already existing when someone has COVID, but COVID itself can cause a new immune system abnormality that leads to the prolonged symptoms.
You know, I think a lot of people think COVID is over, although we're seeing a lot more cases. What advice would you have to the public? Will a vaccine help?
So I've always told people that the most effective way to not get long COVID is to not get COVID in the first place. And the vaccines certainly help with that, right? But we also now have some new information based on research that we just published this past summer, actually, that shows that individuals who have been vaccinated against COVID actually have less symptoms than someone who's not been vaccinated if they do develop long COVID. Let me try to say that again because that sounds a little awkward.
Oh, that makes total sense.
Okay, okay.
And when you say vaccinated, do you mean the two vaccines we all had 3 years ago now, or the vaccines and then the boosters?
Excellent question. So the data that we use for our study comes from some of the initial vaccines with Moderna, Pfizer, and Johnson & Johnson. So we don't have as much data on the current strains out there for COVID as well as the current vaccines and their boosters.
In terms of what is developing, what has developed with COVID, is there any other sort of disease like this that's out there that strikes people this way? I mean, it was so contagious. I mean, here at the station, it just went through and wiped out groups of people. And then now you've got this long COVID, which can be serious enough to put you in the hospital or even worse, perhaps kill you. Is there anything comparable to this in all of medicine?
You know, unbelievably, what we are seeing now with long COVID is actually a sequel for many other events that have happened in history. I mean, we've had individuals with prolonged symptoms after influenza. We've also seen similar things with some of the viruses that cause mononucleosis, or mono for short. We've actually even seen this with the previous coronavirus outbreaks, like SARS back in about 2004. The reason we didn't hear about it much was that was a much smaller scale outbreak. So yes, we have seen this before. And the symptoms that we see in long COVID are very similar to another condition called chronic fatigue syndrome and myalgic encephalomyelitis. In fact, many of the treatments that we use for the treatment of long COVID have come from the treatments of those conditions. Whether or not they're truly the same condition, though, that remains to be determined with more research.
Should people be aware of this and know that possibly they could get misdiagnosed?
Absolutely. So the symptoms of long COVID, since they can be so varied, it's very easy to get long COVID convinced with other diagnoses or vice versa. So I remind my patients that they need to be very careful in describing their histories of their COVID infections to their healthcare providers to make sure they have the right diagnosis.
And is there any cure for it?
Unfortunately, we don't have a cure for long COVID at this time. We need to do a lot more research to figure out what's really going on at a cellular level in order for us to be able to develop that. But that being said, while we don't have a cure, we are getting better at treating it. We know that people need help with their rehabilitation. And now there are some medications that we've added to our treatment paradigms that really seem to be helping people get better, even individuals who are 2 years or more out from their infection.
Well, Dr. Vanichkachorn, that was fascinating. Thank you so much for your time.
Yeah, no problem. Thank you so much for having me.
Next, a Twin Cities doctor talks about what she sees in the long COVID cases at her hospital. Joining us right now, Dr. Hannah Lichtsinn of Hennepin Healthcare. Dr. Lichtsinn, thank you so much for coming on.
Oh, it's my pleasure. Thanks for having me.
There seems to be so much confusion about long COVID. What are doctors seeing in hospitals that they are saying that's long COVID?
Yeah, long COVID can look a lot of different ways for many of our patients, and it's something that we see still with people who are struggling from cases that started a long time ago, and also for people who are developing these long-term symptoms newly, right? So with new infections, we see people primarily with symptoms related to fatigue, a lot of chronic fatigue and difficulty with exercise. So what would have been an easy task, say doing the laundry or going for a walk, now leads to a racing heart and just lots and lots of tiredness and shortness of breath, and can take hours to recover from something that should be easy. But it can take a lot of different forms. So we see a wide variety of symptoms.
What should people know? Because I think people are going to be listening to this and say, well, maybe I've got long COVID. I mean, what should people know? What should they do if they're suspecting this?
Yeah, so I mean, the first thing to do is check in with your healthcare provider, whether it's a family medicine doctor, an internist, just whoever your medical home base is. They'll be able to listen to hear about what symptoms someone's having, to get a better sense of, could this be long COVID? Because it could also be lots of other things, right? So a lot of these symptoms can be caused by other disease processes that can lead to difficulties. And so it's important to get checked out if something doesn't feel right in general.
All right, how about vaccines? Where do they come into play with long COVID?
Great question. So we know now that vaccines help prevent against long COVID. So one of the difficult things with these long COVID symptoms is that people who even have a more mild course of the infection still are at risk for developing long-term symptoms. Certainly people who have
So the long COVID symptoms could they be worse than the symptoms they had for COVID?
Different, yeah, worse, but also different. And so what we see is that people who are more sick, so in the hospital or especially in the ICU, have the highest risk of long COVID. But people with mild illnesses who never had to go into the hospital are still at risk for developing symptoms. We do know that the vaccine is protective. Doesn't mean you absolutely couldn't get long COVID, but it means the risk of it happening is much lower.
Or does it make the long COVID less severe?
Potentially. We don't have great data that shows or compares severity of those long-term symptoms, but we do know you're less likely to develop long-term symptoms at all if you've had the vaccine.
And this is obviously this is all new, and doctors are discovering things as well. I think some people may wonder, well, I did have those 2 vaccines that were the initial set of vaccines, and they just didn't go with the boosters. Do you need the boosters to also really be prevented from having long COVID or a lesser degree of long COVID?
Yeah, it is. If you haven't had any of the boosters or you haven't had a vaccine in over a year, it is definitely time to get back in to get that added protection. The COVID virus has just changed so much over the past few years, and the vaccine that we have now in our pharmacies and our clinics is very different from what we started with, just because the virus has changed. And so it's a really smart idea to get protection from the virus as it is now, which is quite different.
Just anecdotally, I'm hearing about more people with COVID this fall than I did, 2-3 months ago. Are you seeing it in the hospital?
We absolutely are. We're seeing people with COVID in our clinics and in the hospital now. And the numbers certainly are going up. It's hard to know how high they'll get, but as we've talked about, getting a vaccine and staying home when you're sick are the best ways to prevent this from spreading too much further.
Dr. Hannah Lichtsinn, thank you so much. We really appreciate your insight.
Oh, it's my pleasure. Thanks for having me.
And that does it for this edition of Talking Points. As always, you can email me with comments or suggestions at esme@wcco.com. The show airs every Wednesday and Thursday night at 6:30 and 9:30 p.m. on CBS News Minnesota. Thank you so much for watching. I'm Esme Murphy, WCCO News.